Are you feeling a bit anxious because your latest blood test showed high creatinine levels? Well, before you jump to conclusions about kidney problems, there's something important you should know. It turns out, common supplements you might be taking could be the culprit, not necessarily your kidneys. You see, creatinine is a key biomarker used to evaluate kidney function, but certain supplements can cause elevated levels, potentially leading to some confusion about your kidney health. Many people unknowingly take supplements that may artificially increase creatinine, and this sometimes prompts unnecessary concern or even intervention. So, let's take a detailed look at 5 common supplements that could raise your creatinine. We'll explore what you should know and what the research really says. Number 1, creatine supplements. First up, let's talk about creatine. Creatine is a naturally occurring compound. You can find it in small amounts in foods like red meat and fish, and our bodies also synthesize it, mainly in the liver, kidneys, and pancreas. It plays a really crucial role in energy production, especially in our muscles, by helping to regenerate adenosine triphosphate, or ATP, which is essentially the body's main energy currency. This is absolutely vital for those short bursts of high-intensity activity. So, how exactly can creatine supplements lead to higher creatinine readings in a blood test? Well, it's mainly through its natural breakdown process. Once creatine is used by the muscles, or if there's just an excess of it, it gets converted into creatinine. This creatinine is then filtered out of the blood by our kidneys and excreted in urine. So, when you supplement with creatine, you're directly increasing the amount of creatine available in your body. This, in turn, leads to a higher rate of creatinine production and, as a result, higher levels of it in your bloodstream. It's no surprise that athletes, bodybuilders, and fitness enthusiasts often turn to creatine supplements to enhance their performance. The benefits are pretty well documented. It can help improve strength, increase muscle mass, and boost exercise capacity, especially in activities that involve quick, powerful movements like weightlifting or sprinting. By increasing the availability of phosphocreatine in the muscles, it allows for faster ATP regeneration, which helps delay fatigue and enables more intense training sessions. Now, research findings consistently show that creatine supplementation can indeed elevate serum creatinine levels. Studies published in respected journals like the Journal of the International Society of Sports Nutrition and the Clinical Journal of the American Society of Nephrology have observed this effect. But, and this is important, these studies also note that this rise in creatinine in healthy individuals who are taking recommended doses of creatine doesn't typically indicate kidney damage. Instead, it just reflects the increased breakdown of the supplemented creatine. So, the crucial question here is, does this supplement-induced rise in creatinine actually mean there's kidney harm? Well, for individuals with healthy kidney function, the general agreement in scientific literature is that creatine supplementation, when used appropriately, does not cause kidney damage. Your kidneys are simply processing and excreting a larger amount of creatinine, which is a normal physiological response. That elevated creatinine level is more of an artifact of the supplementation itself, rather than a sign that your kidney's filtration capacity is impaired. Despite its general safety for healthy individuals, certain groups should definitely exercise caution with creatine use. People with pre-existing kidney disease or those at high risk for kidney dysfunction, for example, individuals with diabetes or hypertension, should really consult their healthcare provider before even considering creatine. If they do choose to use it, monitoring kidney function more closely might be necessary to ensure it doesn't worsen their condition. Understanding this distinction is absolutely key before we move on to look at another common type of supplement. Number 2, protein supplements and high-protein powders. All right, moving on to our second point, protein supplements and high-protein powders. The connection between protein metabolism and creatinine production is actually quite direct and significant. As we've learned, creatinine is a byproduct of muscle metabolism, specifically from the breakdown of creatine phosphate in muscle tissue. Now, while dietary protein itself isn't directly converted into creatinine, a high protein intake, especially from animal sources rich in creatine like red meat, can contribute to higher baseline creatine stores. These stores then break down into creatinine. Plus, our kidneys play a vital role in processing the byproducts of protein metabolism, such as urea. So, when you're consuming high-protein diets or using concentrated protein supplements, think whey, casein, or soy powders, it can lead to a noticeable increase in your blood creatinine levels. This happens because a higher protein intake can actually increase muscle mass over time, which means more creatine turnover. On top of that, some protein powders might even contain added creatine, or the amino acids from the protein can support your body's own creatine synthesis. As a result, the kidneys have to work harder to filter the increased waste products from protein digestion, and this increased workload can sometimes show up in lab tests. When we think about foods like red meat and beverages like protein shakes, it's important to distinguish between their temporary and chronic impacts on creatinine. For instance, eating a large portion of cooked meat can cause a temporary rise in creatinine because cooked meat actually contains creatinine, which then gets absorbed into your bloodstream. Similarly, a protein shake might contribute to a slight temporary increase. However, if you're on a consistently high-protein diet that supports increased muscle mass, this can lead to a chronically higher, though often still normal, baseline creatinine level. Now, for individuals who already have existing kidney conditions like chronic kidney disease, the stakes are definitely higher. Their kidneys already have a reduced capacity to filter waste products. So, a high protein load can put additional strain on these compromised kidneys, potentially accelerating the decline of their kidney function. That's why these individuals are typically advised to follow a protein-restricted diet, carefully tailored to their specific stage of kidney disease and always under the guidance of a nephrologist and a renal dietitian. So, what are the recommendations for safe protein intake? Well, they really vary based on your individual health status, age, and activity level. For healthy adults, the general guideline is about 0.8 grams of protein per kilogram of body weight per day. Athletes or highly active individuals might benefit from higher amounts, typically ranging from 1.2 to 2.0 grams per kilogram. It's also crucial to distribute your protein intake throughout the day and to stay well hydrated, especially when consuming higher levels of protein, to help support your kidney function. If you're concerned at all, discussing your personalized protein needs with a healthcare professional is always the best approach. And speaking of things that can affect your levels, beyond protein, other common items in your medicine cabinet could also be playing a role. Number 3, nonsteroidal anti-inflammatory drugs, NSAIDs. Let's move on to number 3, nonsteroidal anti-inflammatory drugs, or NSAIDs. Many of us reach for these common over-the-counter drugs to relieve pain, reduce inflammation, or lower a fever. You'll recognize familiar names in this category like ibuprofen, often sold under brand names like Advil or Motrin, and naproxen, which you can find in products like Aleve. While they're effective for what they're designed to do, their impact on kidney function and creatinine levels is an important thing to consider, especially if you're using them frequently or for a long time. So, how do NSAIDs affect kidney function and in turn, creatinine levels? Well, it's primarily by interfering with prostaglandins. These are hormone-like substances in our bodies, and they play a crucial role in maintaining blood flow to the kidneys. By inhibiting prostaglandin synthesis, NSAIDs can actually reduce blood flow to the kidneys. This is especially true in situations where kidney perfusion might already be compromised, like if you're dehydrated or have underlying kidney disease. This reduced blood flow can impair the kidney's ability to filter waste products, including creatinine, which then leads to an increase in its concentration in the blood. The risks associated with using NSAIDs can really differ based on how long you use them. For individuals with healthy kidneys, short-term use at the recommended doses is generally considered safe and is unlikely to cause significant kidney problems or lasting elevations in creatinine. However, long-term, chronic use, or taking doses higher than recommended, can definitely increase the risk of developing acute kidney injury or worsening pre-existing chronic kidney disease. This prolonged impact can lead to more persistent elevations in creatinine, which could be a signal of impaired kidney function. Now, certain individuals are more at risk for NSAID-related kidney issues. This includes older adults, those with pre-existing kidney disease, heart failure, liver cirrhosis, or conditions that reduce blood flow, such as dehydration. People who are taking other medications that can affect the kidneys, like diuretics or certain blood pressure medications, are also at a higher risk. The signs of NSAID-related kidney problems can be subtle, but they might include things like fluid retention, swelling in the legs or feet, decreased urine output, fatigue, or even unexplained nausea. To minimize these risks, it's really advisable to use the lowest effective dose of NSAIDs for the shortest possible duration. If you find you need long-term pain relief, exploring alternatives with your healthcare provider is a really good strategy. Acetaminophen, or Tylenol, is often suggested as an alternative for pain relief because it doesn't typically affect the kidneys in the same way NSAIDs do, though it's important to remember it has its own set of precautions, especially concerning liver health. Staying well hydrated and avoiding NSAIDs altogether, if you have known kidney disease, are also crucial safety tips. All right, next up, we're going to explore how a common medication for heartburn might influence your creatinine readings. Number 4, acid blockers, cimetidine. Coming in at number 4, let's discuss acid blockers, specifically cimetidine. H2 blockers, which are formally known as histamine H2 receptor antagonists, are a class of medications designed to reduce stomach acid production. They're commonly used to treat conditions like acid reflux, heartburn, and peptic ulcers. While there are several H2 blockers available, such as famotidine, you might know it as Pepcid, and ranitidine, which was Zantac, though it's been largely recalled for other reasons, Cimetidine, or Tagamet, has a particularly unique characteristic when it comes to creatinine levels. Cimetidine really stands out because it can elevate your blood creatinine levels without actually causing any harm to your kidneys. The way it does this is quite specific. Cimetidine essentially competes with creatinine for secretion in the kidney tubules. You see, our kidneys remove waste products like creatinine from the blood through two main processes: filtration at a place called the glomerulus and secretion in the tubules. Cimetidine inhibits this tubular secretion of creatinine. This means less creatinine is actively moved from the blood into the urine through this pathway, resulting in a higher concentration of creatinine remaining in the bloodstream, even though the kidney's actual filtration ability, or glomerular filtration rate, remains unchanged. And this is interesting. There have been documented cases where the use of cimetidine has led to a false alarm about kidney health, all because of these elevated creatinine readings. A physician who isn't aware that a patient is using cimetidine, or perhaps is unfamiliar with this specific interaction, might misinterpret the higher creatinine as a sign of developing kidney dysfunction. Naturally, this can lead to unnecessary anxiety for the patient and potentially even further unneeded investigations. It really underscores just how important a complete medication history is when it comes to interpreting lab results. So, for individuals who need to manage acid reflux but are also concerned about their kidney health or creatinine levels, several safe options do exist. If cimetidine is causing an elevation in creatinine that complicates monitoring, switching to another H2 blocker that doesn't have this effect, like famotidine, could be considered. Proton pump inhibitors, or PPIs, are another class of effective acid-reducing medications, although it's worth noting that long-term use of PPIs has its own set of potential concerns that should definitely be discussed with a doctor. And don't forget, lifestyle modifications like dietary changes and elevating the head of your bed can also significantly help manage acid reflux symptoms. As always, it's best to consult with a healthcare provider to figure out the safest and most effective approach for your specific situation. Now, moving from stomach relief to fighting infections, it turns out other medications can also present a somewhat misleading picture of kidney health. Number 5. Certain antibiotics, Trimethoprim, Sulfamethoxazole. And finally, at number 5, let's talk about certain antibiotics, specifically Trimethoprim, Sulfamethoxazole. This combination antibiotic, often known by brand names like Bactrim or Septra, is widely used to treat a variety of bacterial infections. We're talking urinary tract infections, respiratory infections, and skin infections. Trimethoprim, which is one of the components, is particularly relevant when we're discussing creatinine levels, and it's possible that other related antibiotics might have similar effects. Much like cimetidine, trimethoprim can cause an increase in serum creatinine levels, not by damaging the kidneys, but by interfering with the normal process of creatinine secretion. What happens is, trimethoprim competes with creatinine for transport through something called the organic cation transporters, which are found in the proximal tubules of the kidneys. This competition reduces the amount of creatinine that's actively secreted from the blood into the urine. This, in turn, leads to its accumulation in the bloodstream, and therefore a higher measured creatinine level. But again, the kidney's actual filtration capacity typically remains unaffected. Now, this interference with creatinine secretion holds particular clinical significance for patients who already have kidney disease or those whose kidney function is being closely monitored. For these individuals, an accurate assessment of kidney function is absolutely critical for managing their condition and adjusting medication dosages. So, an unexplained rise in creatinine due to trimethoprim could easily be mistaken for a worsening of their underlying kidney disease. This could potentially lead to inappropriate changes in their treatment plan or even unnecessary medical interventions. So, if you're prescribed trimethoprim or a related antibiotic, and you know that your kidney function is being monitored, it's really important to inform your doctor. Healthcare providers who are aware of this potential interaction can interpret your creatinine results much more accurately. They might consider this effect when evaluating your kidney status, or they could choose an alternative antibiotic if there's a concern about obscuring the true picture of your kidney health. Open communication is key to ensuring that your lab results are understood in the correct context. Other factors that can raise creatinine. Now, beyond the specific supplements and medications we've just discussed, it's worth noting that several other factors can also influence your creatinine levels. Dehydration, for instance, concentrates the blood and can lead to a temporary increase. Having higher muscle mass naturally results in a higher baseline creatinine, and so does recent intense exercise. A diet that's very high in protein, especially cooked meats, can also contribute. And there are certain herbal supplements that have been anecdotally linked to changes in kidney markers, so these also warrant caution and a discussion with your healthcare provider. It's really vital to help your doctor distinguish these effects from true kidney dysfunction to ensure an accurate diagnosis. So, to wrap things up, it's clear that several common supplements and certain medications can indeed cause an elevation in your creatinine levels, and often this doesn't indicate any actual damage to your kidneys. Understanding these potential interactions and making sure these changes are interpreted correctly are absolutely crucial for your peace of mind and for receiving appropriate medical care. If you have any concerns at all about your creatinine results, please always discuss your full supplement and medication regimen with your healthcare provider. They can give you an accurate assessment and personalized guidance. Did you find this information useful? We hope so. Please feel free to share this with others who might benefit, and be sure to subscribe for more science-backed health updates. Do you have any questions or perhaps some personal experiences with supplements and kidney tests? We would genuinely love to hear from you. Please comment below with your insights and stories to help keep this important conversation going.